Welcoming a newborn into the world is a moment of profound joy, excitement, and, naturally, anxiety. For many parents, the first month with their baby is a whirlwind of emotions, sleepless nights, and a constant quest for understanding what their infant needs. One of the most pressing concerns for new parents is ensuring that their baby sleeps soundly and peacefully. At the same time, this stage is a critical foundation for the child's physical and emotional development. Understanding how to help a newborn sleep well and knowing the essentials of caring for a 1-month-old can not only ease parental stress, but also give the child the best possible start in life. From the very beginning, it's important to recognize that a newborn's sleep patterns are fundamentally different from those of older children or adults. Newborns have tiny stomachs, rapidly developing bodies, and immature circadian rhythms. During the first month, babies typically sleep between 14 and 17 hours in a 24-hour period, but this sleep is fragmented into short stretches, often lasting between 2 and 4 hours at a time. This is perfectly normal, as their bodies wake frequently for feeding and comfort. Helping a newborn sleep soundly and feel secure begins with understanding their basic needs. The first of these is comfort. Babies just emerging into the world are adjusting from the warm, snug environment of the womb to the outside world, which can feel overwhelming. Recreating some of the sensations of the womb can help your baby feel safe. Swaddling, for example, is a time-honored practice that involves wrapping your baby snugly in a lightweight blanket. This gentle pressure can prevent the startle reflex from waking your baby and can provide a sense of security, much like being in the womb. However, ensure that the swaddle is not too tight, and always lay your baby on their back to sleep to reduce the risk of sudden infant death syndrome, SIDS. The environment in which your baby sleeps is equally important. Keep the room at a comfortable temperature. Between 68 and 72 degrees Fahrenheit is ideal, and avoid overdressing your baby. A quiet, dimly lit room can help signal to your baby that it is time to sleep. Blackout curtains or a soft nightlight can be useful, and a white noise machine or gentle lullabies can mimic the soothing background sounds that your baby heard in the womb, further promoting calm and relaxation. Establishing a simple bedtime routine, even at this early age, can help prepare your baby for sleep. A bath, a gentle massage, cuddling, or softly singing to your baby can all serve as cues that sleep time is approaching. Consistency is key, as even very young babies begin to pick up on patterns. Over time, these rituals become powerful signals that it is time to wind down and rest. Feeding is another central aspect of newborn care that intertwines with sleep. Newborns feed frequently, every 2 to 4 hours, sometimes more, for both nourishment and comfort. During nighttime feedings, keep the lights dim and interactions soothing and quiet to help your baby distinguish between day and night. During the day, allow plenty of natural light to enter the room and engage your baby with gentle play and conversation. Gradually, your baby will begin to learn the difference between night and day, setting the stage for longer stretches of nighttime sleep as they grow. Sleep safety is paramount. Always place your baby on their back to sleep, on a firm, flat mattress in a safety-approved crib, bassinet, or play yard. The mattress should be covered with a fitted sheet, with no loose bedding, pillows, toys, or bumper pads in the sleep area. These guidelines help reduce the risk of SIDS and create a safe sleep environment. Recognizing your baby's sleep cues is another important skill. Yawning, rubbing eyes, fussiness, or staring off into space can all indicate that your baby is ready for sleep. Try to put your baby down when they are drowsy but still awake. This helps them learn to fall asleep on their own, a skill that will serve them well as they grow older. Beyond sleep, the first month is a period of rapid growth and change. Feeding your baby on demand, whether through breastfeeding or formula feeding, is the best way to ensure they are getting the nutrition they need. Breast milk is uniquely suited to your baby's needs, containing the perfect balance of nutrients and antibodies. If you are breastfeeding, it's normal for your baby to want to nurse frequently, as their stomach is only the size of a small marble at birth and empties quickly. If you are formula feeding, be sure to follow the instructions on the packaging and consult with your pediatrician about the appropriate amount and frequency. Bonding with your baby is as important as their physical care. Skin-to-skin contact, where your baby lies on your bare chest, helps regulate their temperature, heart rate, and breathing, while also fostering emotional closeness. Talking, singing, and making eye contact with your baby, even though they cannot understand words yet, nurtures their developing brain and helps them feel secure and loved. During this first month, your baby's senses are awakening. They begin to recognize your voice, your scent, and your touch. Simple activities like gently rocking your baby, softly singing, or taking them for a walk in a stroller provide essential stimulation without overwhelming them. Keep in mind that newborns can become overstimulated easily, so watch for signs like turning away, fussiness, or clenching fists, and give your baby breaks as needed. Caring for a 1-month-old also involves paying attention to their health and hygiene. Changing diapers frequently helps prevent diaper rash and keeps your baby comfortable. Bathing your baby 2 or 3 times a week is sufficient to keep them clean. Daily baths are not necessary and can dry out their sensitive skin. Use a mild, fragrance-free cleanser and avoid harsh products. Always support your baby's head and neck during baths and ensure the water is warm, not hot. Umbilical cord care is another aspect of newborn hygiene. Keep the cord stump clean and dry until it falls off on its own, usually within the first 2 weeks. Avoid submerging your baby's belly in water until the cord has detached and healed. If you notice any redness, swelling, or discharge, consult your pediatrician. Monitoring your baby's health is a crucial responsibility. It's normal for newborns to have irregular breathing, hiccups, or sneezing. However, if your baby has a fever, difficulty breathing, persistent vomiting, diarrhea, or seems unusually lethargic, seek medical attention promptly. Regular checkups with your pediatrician will ensure your baby is growing well and receiving necessary vaccinations and screenings. For many parents, the emotional adjustment to caring for a newborn can be challenging. Sleep deprivation is a common struggle, and it's important to accept help from family and friends when offered. Taking care of your own well-being, eating nutritious meals, staying hydrated, and resting when your baby sleeps allows you to be the best parent you can be. Remember, it's normal to feel overwhelmed at times, and seeking support from loved ones or health professionals is a sign of strength, not weakness. In the first month, there is often pressure to be the perfect parent, but perfection is neither realistic nor necessary. What matters most is that your baby feels safe, loved, and cared for. Trust your instincts and do not hesitate to reach out for guidance or reassurance from healthcare providers. Every baby is unique, and what works for one may not work for another. It's also important to support your baby's early development through gentle stimulation. Tummy time, where your baby is placed on their stomach while awake and supervised, helps strengthen neck and shoulder muscles, preparing them for milestones like rolling over and crawling. Start with just a few minutes at a time, gradually increasing as your baby becomes more comfortable. As you navigate the first month, celebrate the small milestones, your baby's first smiles, the way they grip your finger, the soft coos and sighs they make. These moments are fleeting, and while the days and nights may feel long, the weeks will pass quickly. Taking time to savor these early days, even amid the challenges, can create lasting memories and build a strong foundation for your child's future. In summary, helping your newborn sleep soundly and feel secure is an intricate blend of meeting their physical needs, creating a safe and soothing environment, and nurturing a strong emotional bond. Swaddling, maintaining a comfortable sleep setting, establishing gentle routines, and being attuned to your baby's cues all contribute to better sleep and a sense of security. Feeding on demand, practicing safe sleep, and providing loving care are essential components of newborn care. As you care for your 1-month-old, focus on the basics: feeding, sleeping, bonding, hygiene, and health monitoring. Be gentle with yourself and remember that each day is a new opportunity to learn and grow together. Seek support when needed and trust that, with love and patience, you are giving your baby the best possible start in life. The journey of parenting a newborn is one of constant adaptation, learning, and growth. Each challenge is an opportunity to deepen your understanding of your child and yourself. With time, patience, and compassion, For both your baby and yourself, you will find your rhythm. The foundation you lay in these early weeks, built on love, safety, and attentive care, will nurture your child's development and well-being for years to come.